Hi, Dr. Nader. Welcome.
Hi, thank you. Thank you for having me.
Of course. Well, it is noon, so we'll go ahead and get started. Welcome, everybody. Thank you for joining us, and thank you for those of you joining us from overseas. Translation is available for this webinar. Dr. Tony Nader, MD, PhD, is a medical doctor trained at Harvard University and Massachusetts Institute of Technology with a PhD in neuroscience. His training includes internal medicine, psychiatry, and neurology. He was a clinical and research fellow in neurology at Massachusetts General Hospital, Harvard Medical School, and the assistant director of the Clinical Research Center at MIT. Dr. Nader has conducted research in neurochemistry, neuroendocrinology, and the relationship between diet, age, behavior, mood, seasonal influences, and neurotransmitter and hormonal activity, and on the role of neurotransmitter precursors in medicine. He writes on the relationship between mind and body, consciousness, and physiology. Dr. Nader's upcoming book, The Ocean of Consciousness, will be published this spring. As a Maharishi Mahesh Yogi successor, Dr. Nader is the director of organizations teaching Transcendental meditation in over 100 countries. Welcome, Dr. Nader.
Thank you. Thank you to Dr. Gregory Gruner from Loyola University in Chicago School of Medicine, and certainly Dr. Murali Rao, chair of the Psychiatry of Loyola, for inviting me to give this grand round. It is my great joy to discuss this topic in the context of perfect health and mental health in particular. I will be sharing the screen, and we will have some presentation with some slides. Let me first overview a little bit the topics that will be covered. First, briefly, we review mental health areas in clinical medicine and psychology and other some aspects of how to approach mental health. Then we will look at transcendental meditation as a modality for mental and physical health. And I understand that we have an audience that is quite different from its perspective of background. We have great specialists in psychiatry and mental health and neurology, medical doctors, as well as students. We have also great experts in transcendental meditation who are joining to enjoy this session. And we have also many who have never heard maybe about all of these topics, or are not really themselves experts in any of them, but are interested, of course, in being healthy mentally and physically. So my presentation will be geared towards the general audience, but particularly, of course, some aspects will cover technical aspects that are of medical interest. And therefore, I ask you to be patient in terms of one side, those technical aspects that will happen during the discussion, which I'll try to simplify as much as possible, but also for those who are experts, to be patient with some of the simple concepts that will be presented so that we can cover the audience and its broad perspective. So first, let me share my screen, and this shows us that, of course, our discussion is about mental health, and mental health is taken care of medically and generally through different specialties. We have psychiatry that looks at mental health from mostly the relationship of mind and body and what goes wrong in the nervous system, what chemicals, what activities are in the nervous system that are leading to anxiety, depression, poor appreciation of life or reality check, which means sometimes hallucinations and losing contact with what is real, that the brain gets us into a mode where it sees things or hears things or expects things that are not really there for anyone else except the person. So these are the psychoses, the different neuroses, the different aspects of mental health that are dealt with medically. So it's a branch of medicine. We have psychology that deals with the mind. We have psychotherapy as a modality of usually counseling and getting the person to face their situation and realize what's going on. We have less used now, but still there, psychoanalysis, which analyzes one's mind, makes associations between different aspects of awareness, of moods, of images that come either from dreams or from thinking about things, letting the mind go into different directions. And this can, be used also in many ways to help the mind and help mental health. Of course, there is counseling, and there is also a set of other aspects that we use now that have not been usually considered part of the medical profession, of the treating medical aspect or psychological, systematic, scientific approach, but that are making now headways, and they are being considered as important, like mindfulness, for example, where there is what we call open monitoring, so that the mind is allowed to fathom different aspects of one's breathing, of the environment. So the mind is guided into different attention as objects. So put attention on different objects so that it goes away from the stress and strain. So there are different aspects of what mindfulness is, and not all mindfulness techniques are the same.
Осознанности. Не все, естественно, техники осознанности одинаковые. Есть также аспект нашей жизни.
A crença num poder da natureza ou um poder da vida, isso tem importância também no bem-estar das pessoas, principalmente quando tratamos de situações de incerteza, falta de clareza, com a morte.
Morte, lutto.
There are belief systems, and these can also be used in terms of health management of the mind, because people have to have some reference, some understanding, some hope. So it depends what one's beliefs are, but independently of beliefs, this can be included in some ways sometimes in treatment behavior, and we have to keep this in mind also. There are, prayers, there are rituals, and rituals, we see them everywhere, even when we go to a concert, we dress in a certain way, we behave with others in a certain way, we say hello in a certain way. These might be modified during pandemics and all of that, but there are these rituals of society which show a certain way of behaving that helps to give a meaning to certain aspects of our life that are interesting to see in terms of science also. As science progresses into directions of including all these different possibilities. As you see in the slide, I have put transcendental meditation as a separate thing, a different color and in the bottom. And that is because it is something that is really different from all of the above aspects. It is different, yet it supports all of them. It upholds all of them because it creates clarity in the mind. It creates clarity in consciousness. And that's what we're going to be discussing today. So first we'll discuss a little bit about what transcendental meditation is in a simple highlights of what it is not. Then what are its effects in a physiological way. Then we'll study a little bit stress. And before that, we'll go into an important aspect, which is consciousness. What is consciousness and how does it get improved or expanded by transcendental meditation? What is the meaning of that? And then stress and how stress can reduce and narrow consciousness. So consciousness has a dimension, has a quality also. We will discover a little bit that. And then go into the actual effects on the physiology, on the nervous system and electroencephalography, and also on disease processes such as heart disease, blood pressure, stroke, and then look at it from the perspective of the extreme situations that people face in stress that lead to trauma and therefore a post-traumatic stress syndromes. And these will be the highlights. If time allows, we will also consider something very important for today, for our healers in the world, for our doctors, our nurses, our health professionals. That is the burnt out they are facing. And we have tried transcendental meditation in these situations to see what it does and how it can be helpful, and the results are extremely promising. So there we go now with the next slide. Suddenly it's, let's see. Yes, always saying. So transcendental meditation, to transcend, the term to transcend, why is this name? It means really to go beyond. That's what it means. And that technically really goes beyond the physical, beyond thought, beyond feelings, beyond even meaning, even beyond the intellect, beyond any kind of attachment, and even beyond any kind of belief. So we leave everything, and we even leave the individual self. So it goes beyond the individual self. So transcendental meditation is something that is different from mindfulness in that way, because we don't try to guide the mind, we don't try to force it. We just practice a simple natural technique, which means it's a spontaneous process. What happens during the practice of transcendental meditation is a spontaneous process that is based on the tendency of the mind to seek increasing charm. So the mind is always looking for more happiness, more fullness, more joy, more love. And that tendency of the mind to always want more is what is used during the technique of transcendental meditation. So transcendental meditation is not a counseling technique. It is a do-it-yourself technique. It is not analysis or psychoanalysis, because the student is actually taught how to be unconcerned with potential thought associations. So we don't try to analyze the meaning of thoughts. We don't try to associate one thought with another. And that is what differentiates it from analysis, psychoanalysis, or even counseling. So transcendental meditation is also very simple, because there are no special abilities that are needed, no intellectual analysis, no belief. It's a technique. That's why we call it a technique. You flip the light and the light comes. You know, you flip the switch and the light comes. You don't have to know how the electricity works, how the electrical current passes, how the light comes. It's a technique. You just learn how to flip the switch and the light comes. And in this case, you practice a technique which doesn't depend on even intellectually understanding what it does, and the results come. So what you really learn in transcendental meditation is how to effortlessly go beyond thought, to dissolve stress without having to concentrate, to contemplate, or focus, or force the mind in any way. The mind is very simply allowing itself to go to finer and finer states. One practices this technique sitting comfortably in a chair. And if the mind is like an ocean, we can say the thoughts are like the surface waves of the ocean. And as we close the eyes, we learn this technique that allows us to dive inside. And as the mind dives, there is more quietness, until one transcends, which means goes beyond all problems and thoughts and considerations and feelings and all of that, but still remains awake. So it goes to what we call pure consciousness, a state of awareness which has no content within it, but it's really fully awake. Now, the benefits of practicing transcendental meditations are all evidence-based, because mind and body are intimately connected. We will see that it has important effects on the physiology as well as on the mind. And these have been studied scientifically. That's what we call evidence-based. And these are important changes in mental, physical health, as well as behavior and on the level of society. So what does it really do? What does ultimately transcendental meditation do, since it goes beyond the self, beyond the mind, beyond considerations, beyond anything? What it does is really expand ultimately and develop consciousness. And through this, as a side benefit, if you like, one gets all the benefits of peace and happiness within, at the same time dissolving stress, at the same time feeling more integrated, more clear, ability to make better decisions, and transformations in physiology that are very important. So if it develops consciousness, we have to ask ourselves an important question. What is consciousness? Consciousness is really, in one way, we can say, the screen in the movie of life. When you say, I am feeling sad, it means your consciousness is colored by something, which is sadness. When you say, I feel love, then your consciousness is experiencing a quality that is that of love. When you think of something, it means there is a color, a thought, an object of consideration that is projected on your consciousness. Consciousness is primary, is primordial. If you imagine yourself without consciousness, like in deep anesthesia or coma, then it doesn't matter whatever happens. Without consciousness, we cannot dream, we cannot plan, we cannot hope, we cannot love, we cannot solve problems, we cannot create anything. So consciousness is primordial and very important, but because it is such an abstract value, which is difficult to get hold of in a sense, it has been in a sense ignored by science, but today there is a great interest that's coming back into the study of consciousness as such. What is it? Where does it come from? What is consciousness really? There are different terms that deal with consciousness: wakefulness, awareness, alertness, attention, vigilance, and focus are some of them. We might have heard conscience. Conscience is a different thing. Is the in psychiatry, and this the id is the superego, is the moral aspect of thinking, and that's different from the wakeful, alert, wakefulness aspect of what we are considering, or the screen on which all life really happens and all life is projected, and from which it is projected. So there are some substrates of consciousness in the nervous system that science has studied, because when we see that if we do some damage to the brain, for example, then you have a change in the quality of consciousness or the depth of consciousness. And there are different areas in the nervous system that have different functions that deal with consciousness, particularly the cortical area, which is the surface part of the brain, the higher part, the gray matter. There are associative regions that connect different parts together, the thalamus in the middle of the brain, and then the deep areas, subcortical areas, and in the brain stem, which is the stem of the brain that supports the brain, which plays a very important role in modulating the qualities of consciousness. What are the gates of consciousness? The gates of consciousness, as we know, are the senses. This is how we experience our environment. The mind and the feelings, this is how we have thoughts, that could be of all kinds and that are projected on our consciousness. The intellect is that ability to discriminate, the ability to separate between things and say, this is white, this is blue, this is red, this is I like, this I don't like. This is the intellect functioning and discussing in a way what is going on in the mind and what are the things that I am dealing. And then there is the self, which is our inner being, our inner sense of who we are as an individual. Now, studies have shown that there are different layers of activities, and this slide is a little bit technical. That's for the specialist, if you like to review. It's a study that was done and repeated, mainly by Japanese scientists originally, and then repeated again. And that is, there is a different levels of consciousness, which we know are there, and they've been studying the kind of activity in the nervous system that modulates consciousness, or that shows what level of consciousness we have. And we have generally, the usual consciousness, waking, dreaming, and sleeping. And depending on the level of wakefulness, even sleep itself, which is non-rapid eye movement sleep, has a light phase and a deep phase in it. And there are different types of neurons that are activated in different modalities of awareness. When you pass from light sleep to deep sleep, there are these different layers, different aspects that are activated. I leave the slide a little on the screen so that those who are interested can read it, but there is no need to go through those specifically one by one, but just to say that there is a physiological activity that is connected directly with the quality of consciousness. Indeed, whatever happens in our mind has a correlate in our body. Whatever happens in our body, in our nervous system, can modify and change the quality of experience in our mind, in our intellect, and in our consciousness. So mind and body are intimately connected, very deeply connected, and they are practically two aspects of looking at the same thing, which is ultimately the quality of consciousness that is reflected in how an individual perceives these different values. So this is looking at the brain. Here we have the surface value, the upper parts of the brain. This is where actually the content of consciousness is, which means what are the things you're experiencing. And then you have the brainstem, this area in general, and the reticular formation, which is that which modulates the level of wakefulness, the level of awareness. So the level of wakefulness is modulated here. So wakefulness, either you are very alert or dull or sleepy, is usually controlled by a system in these areas, the reticular formation. And then the content of consciousness is in this area. So if you shut down this area, the area of the reticular formation, you cannot have any content because all of this goes to sleep and goes to no content in it. So this is a very simple approach. Now, we know that we have sensory systems that are on the upper cortex and that are localized in different parts of the nervous system. Information processing that we do happens also on a conscious level, but also on a subconscious level, which is implicit perception and implicit learning, and even on an unconscious level, which means it doesn't involve all these higher parts of the nervous system, but still there are these visceral aspects, these deep aspects that are detecting and feeling things and experiencing aspects of awareness. So we can divide, therefore, consciousness into two general categories. One is the actual consciousness, which means what you're conscious of, and that is the content of consciousness. This could be your intentions, your wishes, your emotions, what you plan, and what you perceive. And then you have a background or colors of consciousness, particularly the self, which is our identity, our name, which structure we feel we are, how we see ourselves, where we come from, nationality, status in life, the role that we play. These are like the background of our consciousness, the background of our awareness. Now, this who we are, ourself, the self, that has a physical and cognitive aspect, of course. Then we have different layers that have been generally discussed. The proto-self, which is in the brain stem and hypothalamus. These are the basic bodily functions and homeostasis. We have the core self, which is the midbrain, amygdala, the visceral activities of emotions. And we have an autobiographical self, which is the cortex that leads with language, speech, and memory. So there are different layers of even how we see who we are from a physical perspective, from a more mental perspective also, but all of these are part of the underlying reality that consciousness gives us. Now, where does consciousness come from and how does it develop? And scientists have thought, or mainly philosophers, David Chalmers has coined that term and it's been repeated a lot. There is the easy problem of consciousness, which is you can actually study the physiology and see which parts of the nervous system are involved in this easy problem, which is how to connect the nervous system to the qualities of consciousness. So if you create brain injury somewhere, you don't create it. Of course, if it happens, then you can study what is going on and how consciousness has been changed. You can study what people tell you, the objective values based on electroencephalography, etc. You can try to look at neural correlates of consciousness, and there are all of these techniques, EEG, PET scanning, functional MRI, etc., that helps us to connect thought processes with the content and the level of consciousness. The hard problem that is the problem of consciousness that is difficult to solve, we say the easy problem, by the way, and it's easy, but in a certain sense, it's a huge, very difficult, very complicated mechanism of determining what creates the feeling of redness and clarity of thinking and not, or object perception, the cognitive study of what chemicals, what biochemicals are involved in what part of the brain. These we can call still the easy problem, but the hard problem is, how do you perceive feelings as an individual? Your deep subjective experience of, for example, even pain. We can say pain is, an excitation of a certain type of cells, like C fibers or in the nervous system, and that is, that's how pain is transmitted. But then how does the individual experience pain and know and say, I have pain, or I have a feeling of love, or a feeling of sadness? How do I perceive even redness? You can say that there are these waves and wavelengths that create a certain change in the nervous system, but how does the individual have a subjective, deep personal experience of what redness is, what pain is, what love is? And this is really, so far, has been totally unresolved problem. There are many theories and studies of, the hard problem of consciousness based on these qualia, which means those qualities that are personal and subjective. So there are some neural correlates and the idea of grandmother cells. So there is one cell that is specific, that highlights a certain value. Then if there is a neuronal synchronization in the brain, neuronal integration, information processing, and there are, of course, ideas of quantum mechanics and quantum field theories that take us beyond the surface value into deeper values of reality of nature. And when we look into the reality of life as it is physically, we find that actually we are, as individuals, made out of organs that are made out of tissues, and then cells, and then molecules and atoms. And ultimately, if you go from the biology to the chemistry and you reach the physics part, you find that everything is ultimately fields of energy. And scientists have now been looking at one unified field that is the source of all energy fields. And then these energy fields manifest as elementary particles, atoms, molecules, then cells, and then tissues and organs, and then a human being. So ultimately, from the physical perspective, we are made out of this unified field. What transcendental meditation proposes is that actually our mind can fathom these deep levels, which we call ultimately the unified field of natural law, and that is the self of everyone and the self of everything. Now, this is a topic which is complex, and it takes into consideration the origin of consciousness, whether matter is primary, whether energy is primary, whether consciousness is primary. And I've written a book that is now in print with Penguin Random House. It's called The Ocean of Consciousness. It will be ready by March, and I invite, of course, everyone to look at it if they are interested in this topic and its implication on many aspects of life, health, as well as moral, mental behavior, concepts of happiness and sadness, good and evil, freedom and determinism, because this really puts the whole context of what reality is between its aspect that is on the more abstract level, consciousness, and on the physical level, the physiology and matter. So Going back to consciousness, we know we have different states of consciousness, and the usual states of consciousness that we are aware of are waking, dreaming, and sleeping. And if you look at them, you find that during states of waking, one is active and alert. If one is in dream state of consciousness, one is also active. And this is what the brain studies, EEG, and also blood flow to the brain shows that the activity is there. It's very active physiology. You can even, if you have a bad dream, you can have a heart attack. So it really feels as if it's reality. But when you look at the level of what's happening in the mind, which is alertness and arousal, you see that, in sleep, deep sleep, you are not alert, you're not aroused, but you're restful. In dream, you are not alert, not arousable easily, but you are active. So this leaves us with a box here, and this is of course a very simplified reality, which we see that transcendental meditation fills. And what it does is give us what we call a restful alertness. So you can be very alert, very awake, and yet restful. So it's a different state of consciousness. Transcendental meditation is a different state of consciousness. We will get to that, but in terms of states of consciousness, we have what we call impaired states of consciousness: psychosis, delusion, hallucination, then minimally conscious state, vegetative state, and coma. We have altered states of consciousness that are altered by medication or by different physiological ways of functioning. And these include, as we see here, some dissociative states, hallucinogens that cause different experiences that are not real. Lucid dream, somebody can feel like really they are awake, but they are dreaming, and they actually dream, but while being awake, it's a different kind of consciousness. Sleepwalking, so one can be at sleep, deep sleep, and still walk. Hypnosis and anesthesia have also shown us that we can modify consciousness, and therefore what we call our true perception depends on the way our nervous system works, so that we are really seeing something based on the quality of our nervous system and its ability to handle things and modulate things. Now, there are also higher states of consciousness, which are religious, spiritual experiences, and in this case, what we call transcending, which is a state in which we have broad awareness, very alert inside, but completely restful. So consciousness actually has qualities. It has shades, it has colors, it has impressions that we describe as our experiences, and it has dimensions because you can go very deep into processes, into situations. Somebody who is able to analyze a situation deeply has a deep ability to be conscious. Has wits, it's somebody who can see many aspects at the same time and consider many variables that we can call wits. It has span, it's how it lives in time, and it can be very narrow, it can be also very broad. So this chart shows the relationship between awareness of the environment and ultimately the self and the level of arousal. So wakefulness and content of consciousness. And we see that these different states of consciousness, like in coma, you have very low level of arousal, very low level or none at all awareness of the environment, of course. And then as you go up into these different levels, you see that you have, going into deep sleep, light sleep, then, loss of recall, then awake, hyper alert. And I've put higher states of consciousness of the chart here and here, because in higher state of consciousness, you can have very high level of arousal and yet no content, or if you can call it ultimate content, which is the content of infinite content, of unboundedness. You are not limited by objects, you are transcended. That is what we would then consider as a higher state of consciousness. This is the same chart seen in a different way, and we can see also the relationship between level of consciousness and content in consciousness. Now, these are correlated with brain activity, be it in EEG or here in flow of blood flow to the brain. And we see that in states which is normal consciousness, you can have, of course, higher blood flow. In brain death, of course, there is nothing. And then in deep sleep, you have less blood flow to different regions. Rapid eye movement sleep, it is almost like waking, but a little less. And like this, in general anesthesia, different types of and levels of blood flow to the nervous system. In transcendental meditation, which is what we call restful alertness, restful awareness, we see that we have these blue colors here that are in the brain stem, and yet we have higher activity in the upper value. So if you remember, we said that if these values are low, usually you fall asleep, and therefore it shuts off the upper part of the brain, and therefore you get no content in awareness. In transcendental meditation, it has been shown that, and this is a preliminary study because people didn't want to be exposed to this MRIs and different blood flow studies, functional studies of the brain. So we don't have enough, so that's enough subjects, but this is an indication, an idea of how we have something that looks paradoxical, which is restfulness, because this area of the nervous system, the brainstem and reticular formation, and all this area controls breathing, controls activity. So it's very restful, metabolism is less, and at the same time, consciousness is expanded on the level of the higher parts of the brain. So the higher parts of cognitive, particularly the forebrain, which is anticipation of the future and different functions of higher cognition, they are still active during transcendental meditation and even more alert, more active. This change in transcendental meditation, which is restful alertness, this paradoxical state, can also be seen in the EEG, where we have alpha from 8 to 10 hertz, which is alpha 1. That is an indication of deep rest, deep coherence also between different parts of the brain. And there is a decrease in the indicators of metabolism. Respiration rate is decreased significantly. Skin response is improved. Basal skin response goes in the direction of great rest. And plasma lactate, for example, as one indicator, is reduced significantly during transcendental meditation as compared to normal rest. In fact, you can see here the relationship from a negative perspective. So if you see the blue, which is transcendental meditation, being bigger, it's because these are like minus, how much they decrease. So there is a decrease in these values. So that tells us that transcendental meditation gives us a very different state of consciousness, restful alertness. And that is a normal state of consciousness, but we need to practice it in order to experience it. That's why when we said waking, dreaming, sleeping, I put usual state of consciousness rather than normal, because the real normal also includes transcending, the ability to transcend. Now, this doesn't only lead to alpha wave and alpha 2 increase, but compared to control groups, we see, and these are EEG studies that show which part of the brain are working together. And we see that even alpha 1 and alpha 2 in the TM group as compared to the control group, they have greater coherence, and advanced studies have shown even greater coherence than that. And that is compared to mindfulness, in which actually there is a call upon the mind to be active in a certain way. So you see that it's a different set of waves that happen, and there is not as much coherence. We see here in transcendental meditation, very high coherence between the different parts of the brain. So there are therefore different brain waves that happen between these different techniques of the mind. If you focus your attention, you have higher gamma wave, which is high frequency, that is focused attention. If you practice mindfulness or open monitoring, which is techniques of being there and being aware of things in a relaxed, calm way, you have a different style of brain functioning. And then this automatic self-transcending, which is transcendental meditation, shows a high coherence in the frequencies of alpha-1 between different parts of the brain. This has great significance because it has been shown through different studies that there is a relationship between brainwave coherence that is with transcendental meditation and different indicators, for example, indicators of self-awareness, orientation, improved neurological efficiency, increased moral reasoning, increased creativity, increased intelligence. Even the grades at school are improved. There is increased emotional stability, increased anxiety, and decreased neuroticism. So we have seen, therefore, with different studies and meta-studies, that there is an increase in creativity, in practical intelligence, field independence, which means the ability to focus sharply on one thing, but not forget the environment, not forget the other factors that are being considered. This reminds me of, a flight and some 25 years ago, where the pilots got busy with a little light that was not working, and they all got concerned with the little light, and they forgot to fly the plane properly, and they had a crash. And it was, of course, pilot error, and since then the Federal Aviation Administration, the FAA, established what is called situation awareness training. And transcendental meditation has been shown to allow the individual to focus on an object, but not to forget all the other aspects of life or of what they are concerned, of our concern. And stress sometimes does that. Stress calls upon the flight or fight response. It forces us to focus, so it narrows our awareness onto the object at hand, which is good in order to deal with the object or with the situation, but it makes us forget that there are other things to be considered and other aspects to be taken care of. And so how many of us are crashing their lives because they are focused on one stress and they forget the broadness of understanding and comprehension and all the other factors that are influencing our behavior and that can have much better ability to make us move forward. So that is where transcendental meditation, again, is very important in expanding awareness, expanding the container of awareness, because we usually work on improving the content of awareness, which is the thoughts, the information that we gather, the knowledge that we have, and that is beautiful. But transcendental meditation really expands awareness. It expands the container, so the container can take in more information and has a broad comprehension and field independence with the ability to focus sharply. Now we come to stress. Stress in physics, which is the origin of the term, really is an undue activity or an undue pressure or an undue load on a physical element, could be a metal, a bar, a rod, that leads to deformity or to it cracking. And stress for human beings is the same, is whatever undue load that comes on our physiology and mind creates an actual deformity, a change in the nervous system that leads to improper functioning and therefore less ability to perform, less ability to enjoy life, less ability to have broad comprehension and broad understanding. So we become narrow with a narrow awareness, narrow consciousness, and therefore we are unable to see other values. We are unable to see other perspectives, other logics of life. And that leads to a number of physiological changes that are geared in principle to deal with the stress, but unfortunately they overreact sometimes and makes us have many side effects of this reaction to the fight or flight response, if you like. So stress is a real thing in the physiology. It leads to real aspects of transformations on the biochemical and electrical level of the nervous system and the physiology. The main aspect of stress, it leads to changes in behavior, as we said, and it leads to secretions of hormones, in this case, the cortico release factor, the corticosteroid release factor, which is what influences from the hypothalamus, the pituitary, to lead to ACTH, which is an activator of the adrenal cortex that leads to the release of cortisol, and changes also in epinephrine, and at the same time that are changes that happen in the autonomic nervous system, where in general the parasympathetic system is dampened in its activity and the sympathetic system is increased, so that to prepare us for fighting and to prepare us to fight inflammation in the body. So stress generally leads to metabolic mobilization, increased heart rate, blood pressure, and increased respiration. It redistributes the blood flow and suppresses the immune, inflammatory, and digestive functions in preparation for fighting a situation that is dangerous. Stress has profound effects on the cellular level, even in the nervous system, and can have many changes leading on experience of depression or anxiety. And these have been studied and are being worked out as actual biochemical counterparts of stress, including inflammatory responses. Now, when one has a stress situation, a fear, one is having many things happen. As we said, in the biofunction, including reproductive function, is reduced. And these all have been studied. And if stress becomes acute, then it leads to chronic, with time, if it continues, to chronic changes in the physiology that actually lead to disease. So the physiological effects of transcendental meditation have been studied. And what I'm showing here are studies, not just some nice ideas, studies that have been done and repeated. This one is in the American Journal of Physiology, but there have been many analyses, Scientific American and Science, that show in a summary that transcendental meditation does the opposite of what fight or flight and stress lead to. It decreases respiratory rate, decreases heart rate, decreases blood pressure, decreases muscle tension, and leads to dry palms. Dry palms is not a problem. It's actually when you have sweaty palms is when you are under stress and want to fight or run away. That's how it is. Dry palms is an indication of the skin being relaxed and not the sweat is not there. The skin means the appearance of stress in the skin. So as far as cortisol is concerned, which is plasma cortisol, we see that in transcendental meditation, during the process of transcending, the cortisol level decreases, indicating the system is more relaxed, and it stays a little lower even after the practice of transcendental meditation. And that is how, with all the different mechanisms, it has been shown that transcendental meditation reduces blood pressure. And there have been many randomized controlled trials that show progressive muscle relaxation and education are less effective than transcendental meditation in reducing blood pressure. So there are controlled studies with different techniques, education, or a system that's called progressive muscle relaxation. And it shows that transcendental meditation significantly improves and does better than other techniques. These older studies have been repeated, and there have been a meta-analysis that has been published in the American Journal of Hypertension that shows that both systolic and diastolic blood pressure are reduced significantly in those who practice transcendental meditation. These are another meta-analysis which has more controls of different types of management. You can see transcendental meditation reducing blood pressure in a very significant way as compared to, again, muscle relaxation, stress management, biofeedback, or different kinds of combined treatments. That's how the American Heart Association has acknowledged transcendental meditation as a technique and recommends it as a treatment plan for individuals with blood pressures that are higher than 120/80. So it's evidence-based research showing that transcendental meditation can lower blood pressure, and that other meditation techniques, including mindfulness-based stress reduction, received a lower class of no benefit level of evidence. And that's why the American Heart Association sees the modality of transcendental meditation as the most effective modality in treating blood pressure and other cardiovascular related disease. Here we have controls for death, heart attack, and stroke, a study that was published in Circulation, and it shows that transcendental meditation shows a decrease of 66% over average of 5 years follow-up in the events per year, per 1,000 event-free persons reporting through clinical studies and follow-up by physicians. There is significant reduction in these factors, these important outcomes of heart disease, blood pressure, etc., which is actually death, heart attack, and stroke. So it is interesting that in any study you have people who don't practice regularly, some don't practice at all, and some practice irregularly. And therefore it was interesting, instead of discarding those who practice irregularly, to include them in the study and to show that regular practice of transcendental meditation has a better reduction than the irregular practice of transcendental meditation in heart attacks, strokes, and deaths. And so regularity in the practice of meditation is of utmost importance also to improve and have maximum results. Now we come to a factor which is stress and stress-related issues that are extreme under, for example, traumatic situations of life events, loss, or being in the military and war veterans and facing situations of constant demand on them. And the treatments from the drugs level is not so effective. That some effectiveness, and there have been tried many educational procedures and programs. And since the veterans are really looking for something, they checked about the results of transcendental meditation. And we have tried this research, not myself, but many scientists. Here we can see them during different years that have tried transcendental meditation and its effectiveness on the level of stress and PTSD situation. So it has shown significantly in every one of these a much more significant reduction in stress than compared to other mindfulness-based stress reduction techniques repeatedly done. And that's why this technique is being used in the stress situations for veterans and in the treatment of PTSD, post-traumatic stress disease, and all the syndromes and the symptoms of that disease. Overall, health insurance statistics have shown, to go to a further, bigger area of consideration, that transcendental meditation improves hospital admissions per 1,000 members, and that is in all areas, including nose, throat disease, heart disease, and all other, even including injuries and problems with infection disease in the nervous system and other aspects of health. That shows the effect is very, very wide range on all aspects of awareness and physical activity. This is another important study in PTSD in military veterans that compares transcendental meditation to prolonged exposure and to health education techniques that have been used. Again, it shows by the different clinically administered, clinicians administered schedules or patients, themselves, what they feel, and other depression factors, the importance and the significance of the difference in transcendental meditation's effects. So we have studied this also in emergency medicine. We have a burnout rate that is very high with physicians. And now it's wonderful studies taking place that show in different factors reduce physician burnout through transcendental meditation, including scales of burnout that are used internationally, but also depression, insomnia as part of these scales, all showing very important changes. So these changes are very significant, but the time has gone and I have been over the time. And in summary, just to say, it's a complete technique that is acting on a very basic, very profound level, which is consciousness, awareness, through giving deep rest, it dissolves stress, and improves ability to think and act in a way that is more conducive to better behavior, better choices. And that is because it really expands consciousness and anchors the individual within themselves. And the long-term benefits are very powerful on mind and body, on stress, on cardiovascular disease, and as we have seen on post-traumatic stress disorders or diseases, and on all aspects of health and well-being, immune system, and other aspects, because there is more integration, more rest, and more proper functioning of the nervous system when you remove the stress and strain from it. So thank you for your patience. I went a little bit beyond the time, but I don't know if we have time for any questions. It will be my joy to answer them. Thank you again for Loyola University, the Psychiatry Department, and all the great organizers for having us in this discussion.
Thank you so much, Dr. Nader. I appreciated kind of the depth of the studies and kind of the different dimensions in which transcendental meditation could be applied. Kind of focusing in on the couple questions that we might have time for. There is someone that is a medical doctor who asks, how do you find time to meditate twice daily along with getting regular exercise? I'm a working mom and I just can't seem to find time for both.
I think time is relative. It's like what do you do during your daily activity depends on the ability to be attentive and to be there and to be present and to be able to do it, to do the action. So when I was in medical school also, I had, pre-med and all that, I was already practicing transcendental meditation. And what I found is that it saves me time. It's an investment that gives you inner strength and inner clarity that allows you to perform better in activity. So give that strength to yourself so that you can give strength and support to others. It is not hiding away from activity. It's to the contrary, to be prepared so that we can act in an effective way and use our time so that we can accomplish much more by doing much less. And be practical in terms of the timing of the transcendental meditation. You can do it when you wake up, or you can do it whenever you have a little time. It's not absolutely necessary, although it is advised to be regular timings, morning and evening. But if you cannot, then whenever you find time, find the time to do a little meditation. It anchors you back and gives you the strength to act in a most effective way.
Sounds like there's ways to kind of integrate it into your daily life schedule and then also to consider an investment in sort of your daily routine anyway. Okay.
Exactly.
And then probably the last question that we have time for is one about what's the fundamental difference between transcendental meditation, mindfulness, and other meditation approaches. I think you covered it a little bit in your presentation, but if people were to walk away with kind of a summary of what's the main difference and what makes it so special, what would you say about that?
Transcendental meditation is simple. It doesn't involve manipulation of the mind. It allows the mind to be guided by its own nature to go for more charm, more happiness. So it's extremely simple, it's extremely natural and easy to do. And also it takes us beyond the surface level of the mind. That is the most important value. It expands our awareness. So far, we have not studied awareness as something that has dimensions or that has qualities. It's either you're in coma or you're awake or you're deep sleep or REM sleep. But during waking, during all of these states, there is either narrowness of awareness or broadness of awareness, and makes a big difference in our ability to handle life. And so the container of knowledge, the container is expanded during transcendental meditation. And how does it do it? By allowing the connectedness between all different parts of the nervous system to be open. And therefore, if you imagine the nervous system as thousands of chips and even millions of chips sitting everywhere handling things, if these don't talk to each other, then you are just talking to one part or talking to another part. And mindfulness helps to talk to this part or that part, to awaken this part or that part. What transcendental meditation does is, through its simple technique and practice, connect all of these parts. So then you have a computer with multiple chips that are working together, and the computing ability, the understanding ability, the effectiveness and efficiency increases even in practicing mindfulness or in one's own life, one's own politics, one's own beliefs. One can see broader levels of reality and therefore use one's full potential to the maximum that is given to us, and our reserves of the brain that are sitting there unused can now be used for better life and better enjoyment of life and better achievements in life.
Thank you. Well, everyone, thank you so much for coming. Thank you for our international attendees. I was reminded to invite you to the next presentation, January 27th at noon as well. The registration information should be available to you, and that the screen details will be present. There we are. So www.tn.org/Loyola Talks. And then to learn more about the Transcendental Meditation technique, please consider the following links and websites for your reference. All right, well, thank you again so much, Dr. Nader. We really appreciate having you here.
Thank you, Raja. Dr. Raja, it's wonderful to be with you.
Likewise. All right, everyone, take care.
Bye.